Good evening, you're watching Blueprint Explosive Exclusive, and viewers, this is a mega Times Now exclusive. It's a story that impacts every citizen of India. In fact, it's an annual nightmare for those residing in the National Capital Region and the entire belt of northern India. We're talking about air pollution, which peaks every winter, leaving millions gasping for breath. The situation presents itself as a serious health crisis for crores of people across the country. But what's even more alarming is that the government's refusal to acknowledge this full extent of the health impact of this crisis. Times Now will continue to highlight the issue until real action follows. This evening, we will throw light on two replies given by Kirti Vardhan Singh, Minister of State Environment, Forest and Climate Change in the Parliament. One in December last year, which we've already covered back then, but we'll revisit today. And then another yesterday. We'll contrast the minister's reply with what data from the ICMR study shows. Let's quickly take you down to the story. Let's quickly make you understand what exactly we're talking about. This is the entire story. Responses from Kirti Vardhan Singh, Minister of State for Environment. The reply dated 29 January 2026, that is just yesterday, where he says there's no direct correlation of deaths exclusively due to air pollution. This is the response. You can see an excerpt of that. This is a reply dated 29 January. He says there's no conclusive data available in the country to establish that there's a link as far as deaths exclusively due to air pollution are concerned. This is on the 18th of December 2025, where he says there's no direct correlation between higher AQI and lung diseases as well. This is again a response. But what has Times Now done? We have accessed a response of the ICMR. That's the Indian Council of Medical Research. And what have they said? They have said that in 2017, 12.4 lakh deaths occurred due to air pollution. This was also, of course, in a study published by Lancet Planetary Health. In 2017, 12.5% of total deaths were due to air pollution. Over 51% of the victims were below 70 years of age. And this is very significant because anybody who goes out for a living, anybody who breathes the toxic air of the national capital is bound to be impacted, and this is impacting people even below the age of 70. It's not something that happens suddenly when a person is of an age beyond 70 at their old age. Listen into these reactions.
I've never said that AQI has no relation with the lung diseases. I've only said that there was a question, unsought question, that whether the WHO norms apply to us or not. So we have our own norms for air quality indicators, and the WHO norms do not apply in India.
So this was a response when Times Now confronted the minister in December, and he has made a complete U-turn despite the reply in Rajya Sabha being on record. Let's quickly take this across to my colleague Isha Mishra, who's joining us. Isha, very clearly, despite two replies in the Rajya Sabha in December and now in January, where they are denying any connection between deaths and air pollution, the point is that ICMR's data very conclusively establishes that yes, there is a link. Take us through what the ICMR is saying.
Madhav, we've put out three documents for our viewers, two being parliamentary replies and one being a reply of the ICMR, which is also a government body, which has come out and said that there is a concrete link between air pollution and fertilities. In fact, it's also said that these deaths are also occurring in the ones who are below the age of 70. So it's not like these are just small issues that have been taking place. However, when we speak of air pollution, this is an issue that impacts all of us every single year. But it's also important to note that, Madhav, that this report comes from 2017. So there is still 9 years of data that is still missing. So essentially, we're just scratching the surface when we look at the number of deaths that have taken place. India has also had to face global humiliation where global athletes have refused to come to India and have backed out of tournaments, stating that the air quality is extremely poor. When we speak of the national capital, year after year, governments may change, but the smog-like situation refuses to change. In fact, this year, we've seen the government make attempts, one being a water sprinkler and the other being an unsuccessful attempt at doing cloud seeding. So essentially, the point that we are making here at Times Now, Madhav, is that are these mere optics? Because nothing really changes on the ground, and this research that we're also bringing to our viewers is 9 years old. So there is still a lot of data that needs to come up.
Absolutely. And in fact, Isha, thank you so much for joining us with all of those details. The question is, ladies and gentlemen, will we see another U-turn from the minister on the reply that came out yesterday? We'll have to wait for that. But for now, let's listen to what the RTI activist who sought a reply from the ICMR had to say and what doctors are saying on ICMR's data.
And we know that the air pollution is impacting our health. Yesterday, during a question at Rajya Sabha, it was mentioned that there is no conclusive data to link air pollution with the deaths, or to say that deaths were caused directly due to the air pollution. However, in response to one of my RTI, the ICMR has confirmed that in 2017 a study was published and done which has confirmed that around 12 lakhs deaths in India in 2017 were due to the air pollution. Half of those deaths were due to the air pollution, air particulate matters, and around 5 lakhs from the pollution from the indoor or the kitchen and etc.
There is absolutely no doubt in any published data, and the articles range from more than 7,000 and more than 150 India-centric articles which have been published in Lancet Planetary Commission for Air Pollution, British Medical Journal, New England Journal of Medicine, Science Today, Science Direct, JAMA, which have proved unequivocally that more than 1.7 million deaths occur prematurely in India on an annual basis, and this data was of 2021. This figure is almost crossing 2 million, again in published data of Lancet, which are directly because of air pollution.
And the opposition is gunning for the minister. In fact, they are saying that the government is lying even as people are dying because of pollution.
कितने लोग गंभीर रूप से बीमार हुए, कितने लोग की डेथ हुई है, और वो सब पोल्यूशन की वजह से हुए। तो केंद्र सरकार का ये जवाब एकदम झूठ से भरा हुआ है, झूठ का पुलिंदा है कि पोल्यूशन का डेथ से कोई संबंध नहीं है, बल्कि अनेकों डेथ पोल्यूशन की वजह से हुई है। यहां तक कि मेरी खुद की माताजी, उनके फेफड़ों में इतना।
All right, let's quickly take this across to Pramod Tiwari, who's leader of the Congress Party, member of Parliament in the Rajya Sabha. Mr. Pramod Tiwari, this was a question that you had posed in the Parliament, and despite the response that was given last month in December, again, the government saying shockingly that there is no data to prove that deaths are linked to pollution. How are you going to take this further?
देखिए, नियमावली होती है, रूल्स हैं कि जो जवाब एक मेंबर का राइट होता है सवाल पूछने का, सरकार उसे कभी रिटन रिप्लाई, कभी ओरल रिप्लाई, क्वेश्चन एंड आंसर के रूप में देती है। मेरे सवाल पे रिटन जवाब पे, जिसमें मुझे कोई मौका नहीं था कि मैं उनसे सप्लीमेंट्री क्वेश्चन पूछ सकूं, उन्होंने एक जवाब दिया है जो पूरी तरह झूठ, सच्चाई से दूर है, फैक्ट से अलग है। उन्होंने कहा, मेरा सवाल था पोल्यूशन से कितनी डेथ हुई हैं, उन्होंने कहा एक भी डेथ होने के सीधे प्रत्यक्ष या परोक्ष संबंध नहीं है। पर जो आईसीएमआर की रिपोर्ट आई है, आईसीएमआर वो संस्था है जो हर तरह से विश्वसनीय है, क्रेडिटेबल है, क्रेडिबिलिटी पे डाउट नहीं किया जा सकता है। वो उसने संख्या भी बता दी और बता दिया सीधे प्रत्यक्ष परोक्ष जो डेथ्स हुई हैं उसके लिए पोल्यूशन जिम्मेदार है। अब दोनों अगर आप सामने रखते हैं तो सरकार का जवाब झूठा निकलता है। तो मैं इस आईसीएमआर के आंकड़े को और अपने जवाब को दोनों को चेयरमैन को भेजूंगा राज्यसभा में और उनसे आग्रह करूंगा कि सरकार से सही जवाब लिया जाए और जिसने गलत रिप्लाई करके सदन को गुमराह किया है उसका खिलाफ प्रिविलेज का मोशन लाया जाए। तो मैं ये बहुत जल्दी करने जा रहा हूं।
और अब क्या डिमांड करेंगे ऐसी स्थिति में? क्या वो सरकार अपोलोजाइज करेगी? क्या एक्शन लिया जा सकता है?
देखिए, ये तो चेयरमैन पे डिपेंड करेगा। अगर सरकार, हम ट्रेडिशन देखें तो गलत जवाब में सरकार माफी तो मांगती है, सही जवाब भी देती है। और एक्शन भी ये होता है जिन लोगों ने गलत जवाब दिया है। अब मुझे ये देखना है कि ये सरकार क्या डेमोक्रेसी के वो जो लेट डाउन प्रिंसिपल्स है उस पे चलती है या नहीं चलती है, ये तो आने वाले वक्त पे। लेकिन मैं डेफिनेटली रिटन कंप्लेन करने जा रहा हूं। मैं ICMR का डेटा भी रख दूंगा और सरकार का जवाब भी रख दूंगा।
All right. बहुत बहुत धन्यवाद हमारे साथ जुड़ने के लिए प्रमोद तिवारी जी. Let's quickly open this up and take it across to our guest. With us is Shubhendu Shekhar Awasthi, spokesperson of the Delhi BJP. Dr. Govardhan Das is director of IISER Bhopal. Vimlendu Jha, environmentalist, is with us. Manasvi Thapar, lawyer and political analyst, is also joining us. Vimlendu, coming to you first. It's a government that has not just said this for the first time. Yesterday in Parliament, it has repeated this claim last month, in fact in December, where it insisted that there is no link with deaths or no conclusive link of deaths and pollution here in the national capital or otherwise. Now, very clearly, the ICMR data is completely contrary to that. They've cited Lancet sources as well. What are we going to look at now in terms of how the government has been coming out? And is this the reason why, if two government ministries don't talk to each other and don't know each other's data, is this why we are failing utterly in our fight against pollution?
See, this is the backdrop of this is that there is a lot of pressure on the government to accept that, as in, as you rightly said, that, if you deny this data, then you don't have to do anything. It almost makes sure that the government doesn't have to allocate resources or do not have a discussion about this because no one dies. And this is not something that we've seen in 2025 or right now in 2026 when the government actually has the audacity to come and say that no one actually dies or no one even falls ill. In fact, in 2025, in December, the Honorable Minister actually said that no one dies. Not just that, no one even falls ill because of air pollution. And we have so much data. Right now, this 2019 report of Global Burden of Disease or ICMR or of Lancet that we're talking about, for almost a decade, everyone knows. And in fact, there are so many doctors, more than 3 dozen doctors this season have come forward and have talked about the impact that air pollution has on people. Not just in their pulmonological challenge, but also in terms of other health-related challenges. Right. So mortality, morbidity, of course, just a couple of days ago, we've seen Geeta Gopinath talk about the impact that this has on economics. So we talk about environmental impact, we talk about health impact, public health impact, private health impact, and impact on economy. Okay. And here, rather than actually paving way and looking at showing some sort of political intent, we are actually denying this data completely, and this is very, very unfortunate.
Let me bring in the BJP on that. Shubhendu Shekhar Awasthi, International Monetary Fund का भी ये कहना है कि it has an impact on the economy. केवल citizens के लिए नहीं, investors भी चिंतित हैं, लेकिन भारत सरकार को जानकारी ही नहीं है कि प्रदूषण का हेल्थ पे और स्वास्थ्य पे क्या असर होता है. What is going on?
नहीं, देखिए भारत सरकार को सब आइडिया है कि कितना पोल्यूशन है और कितना पोल्यूशन को निपटने के लिए क्या क्या चीज चाहिए, वो सब मालूम है उनको. जो प्रश्न पूछा गया है, भारत सरकार का जवाब जो दिया गया है, यदि आप उस पर रहना चाहते.
कीर्ति वर्धन सिंह का किस मंत्रालय के मंत्री, आप बताइए मेरे को.
तो लीजिए, कीर्ति वर्धन सिंह जी ने जो स्टेटमेंट दिया है, उन्होंने जो स्टेटमेंट दिया है कि कोई भी डेथ खाली पोल्यूशन से नहीं हुई है, उसके साथ में कुछ और भी चीजें थी, उसके कारण खराब हुआ होगा, पर कोई भी ऐसा डाटा उनके पास नहीं है. हाँ, मैं मानता हूं.
तो आपने आईसीएमआर का डेटा नहीं देखा अभी जो आपने प्रेजेंट किया है?
बहुत सारी बीमारियां और फैटल, मैंने आपको वही बता रहा हूं, जो भी पोल्यूशन के कारण कोई बीमार व्यक्ति है, वो और बीमार हो जाता है. ये मैं भी मानता हूं.
आईसीएमआर का जो डेटा है, आपने वो डेटा देखा है कि नहीं? आईसीएमआर कह रहे हैं कि 12.5% जो लोग जिनकी मौतें हुई हैं वो प्रदूषण की वजह से हुई हैं. इट्स वेरी क्लियर सर, यू कांट रन अवे फ्रॉम इट.
सर सुनिए, तो मैं नहीं रन अवे नहीं कर रहा हूं माधव जी, सुनो मेरी बात. जो मैं आज फिर से कह रहा हूं, यदि कोई पोल्यूशन के कारण कोई डेथ हो रही होती, खाली सोलली वही रीजन होता, तो उस एरिया में जितने लोग होते सबकी डेथ हो जाती. मैं ये कहना चाह रहा हूं, या मंत्री जी ये कहना चाह रहे हैं कि यदि कोई बीमार है और उस पे यदि पोल्यूशन का इफेक्ट होता है तो और सीवियर हो जाता है और उसके कारण डेथ हो सकती है.
अवस्थी जी, सिंपल सवाल पे मेरे जवाब दीजिए. अगर कोई बीमार है और प्रदूषण की वजह से उनकी 5 साल पहले मौत हो जाती है, तो प्रदूषण की वजह से मौत हुई है कि नहीं?
बिल्कुल हुई।
एक मानिए ना,
खाली पोल्यूशन की वजह से
नहीं हुई,
वो बीमार थे और पोल्यूशन
में बैठे
हुआ। मैं वही तो कह रहा हूं। मैं आपका प्रश्न जो है, कोई डिनाइल नहीं है, कोई डिनाइल नहीं है। यदि डिनाइल होता तो सरकार ये सब काम नहीं कर रही।
कीर्ति वर्धन सिंह जी यही कह रहे हैं, देयर इज नो डेटा अवेलेबल इन द कंट्री टू एस्टैब्लिश डायरेक्ट कोरिलेशन ऑफ deaths exclusively due to air pollution. Let me go across to Dr. Piyush Joshi, who's also, I believe, Piyush Joshi, you're a doctor. You would know about the links. Please cite for our panelists the kind of data that exists that conclusively links pollution with mortality.
Madhav, there are two things, First, let me speak as a doctor. That's going to help Kirti Vardhan Singh in determining how many deaths are occurring because of air pollution. Forget about Lancet. Forget about Lancet Planetary Sciences. All the publications of Lancet and ICMR, just forget about them for one moment. You have a death registry in your country, don't you? You issue death certificates. Get how many of those deaths are due to chronic obstructive lung disorders. Just get that. And minus the numbers of smokers. That many deaths are occurring due to the air pollution in this country. The Lancet says that it is 7.2%. The ICMR says in the top 10 most polluted countries of the country, 12 to 12.5% deaths are attributable directly to air pollution. And the BJP has the audacity to come forward and say कि कोई air pollution से नहीं मरता. अच्छा चलो कोई air pollution से नहीं मरता तो ये 2.5 माइक्रोन, 5 माइक्रोन और 10 माइक्रोन्स क्यों बना रखे हैं सब पार्टिकल साइजेस? कोई मरता तो है नहीं एयर पोल्यूशन से। 5 माइक्रोन इज डिजाइन्ड फॉर वन एक्सप्लिसिट रीजन, लेट मी एक्सप्लेन माधव, बिकॉज द पार्टिकल साइज ऑफ लेस देन 5 माइक्रोन can actually transgress through your terminal bronchiole and can start to affect the alveoli. And what is an alveoli? It is that place of your lung where oxygen is transported through the blood and carbon dioxide is exhaled.
Yes. And let me put that question. That's a fairly valid question. Dr. Govardhan Das, why do we measure PM 2.5? Because that is the level of the nature of the particle which can severely impact our health. And why are we in denial? It is the year 2026. We should have already had long-term, medium-term, short-term emergency measures to fight pollution. Instead, we're bickering about data. This is utterly shameful.
Madhav, good evening to you and my fellow panelists. Yes, I understand that pollution indeed is a problem and we have to really tackle with it. There's no doubt about it. That's whatever the minister, what the report says, there's no direct correlation. Yes, I understand pollution can exaggerate any symptoms they have, but this is the death, what's his name, Dr. Piyush Joshi was saying, is a simply association. Association and causality are two different things. So association, yes, it is, but is a causality? It may not. So therefore, the way that these people or these patients died because of pollution, that not been established, number one. So yes.
So is ICMR and Lancet all lying? Are you saying that in this particular reply, ICMR is wrong, Lancet is wrong, everybody is wrong?
Don't put words in my mouth. See, go and read it.
No, either it is established or it is not established. You tell us which it is.
No, it is not. It is not established.
It is not established.
Causality.
So that means ICMR is wrong.
Association and causality are two different things. This is absolutely in causality. And in no circumstances I am denying that pollution is not a problem. Yes, pollution is a problem. We have to control it. No other option. And second thing,
is it a fatal problem or not?
Wait.
Is it causing deaths or not? Is it exacerbating deaths or not?
Second thing I would like to mention.
No, tell us, is it causing deaths or not? Do you believe it causes deaths or not?
Is exaggerating the death.
It is exaggerating the death.
Symptoms.
Okay. Manasvi Thapar, it is not causing the deaths, it is exaggerating the deaths. Reply to the doctor.
Madhav, I feel we have come to a stage wherein there is no accountability, there is no answerability, and this is a la-la land in the terms of BJP understanding of things on air pollution. Clean air is something which is not a luxury. It's a constitutional obligation, constitutional right of each and every citizen under Article 21. This is not something which you are giving as a charity. This is a basic minimum which any sarkar who has been in power is supposed to do that. And moving forward, Madhav, what is more important to know is, as per the ICMR data, which is an agency by the government of the government for the people of this country, which clearly says 1.7 million people have died in 2019 alone is because of air pollution, which is 18% of the total death in our country. Moving forward, as per the NCAP data, which says that 130 cities have been selected by the government on its own program, on which they have spent around 13,000 crores to reduce 40% of PM10 in 2025 and 2026. Now, the other question which comes to my mind would be, what is the statistics? How much have you spent of that 13,000 crore on clean air? How much air has been cleaned? What is the data of the 130 cities where you have put this money? Other question is the real data, which Piyush would agree with me, would be that the real enemy is PM 2.5, not
Okay. You know, we have discussed pollution a whole lot. We have been discussing it for a good part of the last 6 to 7 winters here, not just in Delhi, but across the northern part of India. We've seen the impact of it. Unfortunately, even though the IMF is telling us that this is now, concerning for citizens of India, it's high time that we act. It's going to not just impact the lives of citizens, it's going to impact economic activity and investments coming into India. Yet you have government departments which are working in such a blinkered manner, who still say there's no conclusive data to prove that there are deaths exclusively due to pollution. It's high time that the climate change deniers and pollution deniers, anywhere that exist in government or outside, whether they're in the BJP or the Congress or the Aam Aadmi Party, does not matter. We all as citizens have to work together to resolve this, and resolve this immediately. This kind of lying, pushing under the carpet of data is not going to help anyone. Subhendu Shekhar Awasthi, Govt Das, Vimlendu Jha, Manaswi Thapar, Piyush Joshi, thanks so much for joining us this evening.